So basically, this is our BrainsWay TMS machine. This system is designed to treat patients with treatment-resistant depression. Those are treatments who have failed a number of antidepressant trials. So for many patients who are really struggling, this has been a breakthrough. I've had a few patients who have said this has been very life-changing, that this has sort of been the only alternative that has worked for them. This one allows us to do what's known as deep TMS, which also targets symptoms of anxiety and obsessive compulsive disorder. So even if you're someone who just not only suffers from depression, but you might be suffering from those other ailments, this particular TMS system could help address that. We place this coil on top of their head, and the coil delivers an electromagnetic field to a very specific part of the brain. By doing this over a number of sessions, it tends to have an antidepressant effect where patients feel like they have more energy, their sadness starts to lessen, they feel more motivated, they tend to get their interest back, which is amazing to see the transformation in patients who come in severely depressed, no motivation, no drive, and once they complete their treatment course, it's like you're talking with a different person. Honestly, there's not much to be afraid with. Really, it's a pretty, I would say, non-invasive procedure. At its worst, it can cause a little bit of pressure on the temple. That's just the sensation of feeling the electromagnetic pulse. At the worst, sometimes you might leave with a little mild headache. But aside from that, nothing that some Tylenol or ibuprofen could knock out. So really, it's very safe type of procedure and really no side effects. The benefits of this type of system compared to medication, there are no sexual side effects, there's no fatigue, there's no appetite changes, so you don't see any weight gain. So for patients who have also struggled with a lot of side effects from medications, this is also a pretty impressive alternative. A lot of times for patients, once they're on their third or fourth medication trial, your chances of response are probably 25% at best. With this type of treatment, we could actually increase that response rate between 50 to 60%. So again, for patients who have tried a number of medications, your chances of actually achieving remission is so much higher with this type of system compared to something like doing another medication trial.